Nah, girl watching with the itty bitty waist and round thing in your face, you get sprung. Cut. Hi, and welcome back to another episode of Punked. My name is Vinny, and I'm a current first year medical student. Today, myself, as well as another first year medical student, Molly, are going to punk a friend by conducting a whacked out physical examination. The subject believes I'm conducting a standard physical examination for a grade, and that Molly is a chief resident who is observing and grading my performance. He has absolutely no idea what's going on and believes everything's real. Let's see how far he lets us go before realizing that he's just been punked by medical students. Well, don't be that far away. Make sure you... Alright, so Mr. McRae, I really appreciate you coming in today to help us out, help me out with this interview. We're just going to conduct a routine physical examination. Some of the things I'm going to do may be a bit different than you're used to at your normal physician, but just keep in mind that Dr. Mulfler is here. She's going to make sure everything goes smoothly, and that I don't do anything I'm not supposed to do, and I do everything properly. Okay? Alright. So first I'm just going to start off just by checking your heart sounds a little bit. I know you're probably used to the doctors wearing like a stethoscope and checking your sounds like that.
Yes.
But what we're doing now is we've actually been trained on this new instrument. You've probably never seen one of these before.
It's like a kaleidoscope.
No, we get that a lot. Like some people think it looks like a paper towel tube with foil. Some people think it looks like a kaleidoscope, but actually it's a pretty good instrument for hearing the heart sounds.
Okay.
Okay. And so I know that you're probably used to doctor come up to you putting the stethoscope here, 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 here. But actually what we learn in med school is the best place to listen to is actually through the head. And if you can just bend your head like this.
Okay.
You're probably unaware, but actually the brain contains lateral ventricles filled with cerebrospinal fluid, and that kind of amplifies the sound, and so it's a better way for us to hear them. And so just hang on right here. Let me just get a nice spot in there. The hair sometimes muffles the effect. All right, this should be. Yeah, you definitely have a lot of hair. Okay. It's pretty good, pretty clear. I can definitely hear your aortic sound. Let me see the pulmonic. Bend a little further.
Vinny, a trick we learned in residency was you actually have the patient make a very high-pitched nasally sound while they're doing that, and it kind of reverberates through the head and really highlights those sounds.
Okay, I never heard that.
Alvaro, if you could just take a big deep breath in, and make a sound like a balloon letting out air. A little bit more high-pitched.
So high-pitched?
Yes.
Actually, wow, that worked. That worked out well.
I know it must feel
that's
silly.
a good technique.
Why don't you do it one more time? Big deep breath.
Okay.
No, but it made it
It
better.
does, it does.
All right,
I'm sorry.
Can we just hear the tricuspid and mitral real fast?
Okay. Do you want me to?
No, don't do that. These sounds are pretty, pronounced, and so it's actually easier for me to get a good reading on them. Okay. Everything seems to be good. Everything seems to be in order. Let me just put this down. So you definitely have good aortic pulmonic sounds. And the other 7 sounds, I could hear them, they're usually background sounds. You can't really pick them up in a lot of people, but I can see you're pretty athletic, so it's easier to hear them in you, actually. So all 10 sounds are accounted for. Now I'm just going to test your ocular movements, your eye movements. And so it's just a pretty standard exam where I just want you to, look at my finger, follow the movements. Okay, the best you can. Now I'm just going to use 2. Just do the best you can. I know this might be a little more difficult. I'm just going to... Come on, try. Come on, at least try.
Alvaro, you gotta concentrate.
Yeah. All right, here, let's try it again.
You gotta really gotta focus. Yeah.
Okay.
You see, I'm looking for patterns in your eye movement. So your eye may not be able to exactly follow each of the fingers, but I'm looking for certain patterns, and that'll tell me, what might be going on. Alright, so definitely like a little bit diminished response from what I'm used to seeing, but it'll do for now. It definitely happens with age, like younger people I see, they're able to follow a bit better than sounds, it varies among the
Okay.
population. Okay, now I'm just going to have you close your eyes, turn around. Okay. Open your eyes. Okay, that's his startle reflex, and it seems to be in order. That's definitely important, and you seem to have a good response to that. Okay, now stand up for a second. Put your hands flat on this table. Okay. Dr. Muffler, I may need you for this particular task.
Sure.
What we're going to do, can I have you just lean forward a little bit, Alvaro? Keep your eyes closed.
Okay.
I'm going to test your ouch reflex. And so usually I've been told that, I don't know my own strength when I'm doing this, so maybe it's better if you do it.
Sure. All right, Alvaro, I'm going to need you to take a deep breath. Close your eyes.
One more time, I guess.
Now, I just want you to respond how you think you should respond. Ready?
Can you see it?
Interesting.
All right, deep breath. Just respond how you would normally respond.
Are my eyes so close?
Yeah, eyes closed. Wow, you actually laughed at that.
Yeah, I was
Okay.
worried there for a second.
Wow. So, I don't know, turn around, you're fine. You can just, and so that was what's called a spank reflex. It's not really called that, but we call that for short because we're actually spanking the patient. But we were expecting an ouch, or some type of reaction. But
Well,
so
I felt it, but it's
did you
not like
feel
it
like a
hurt.
pain response, or
Not painful.
like on a scale of 1 to 10, how would you rate what you felt?
Like on what kind of rating?
Where 1 is the least pain you've ever felt, 10 is like childbirth.
Probably like maybe a 2 or something.
Okay.
Not like a.
So maybe it was more on our part, I guess. Yeah. Next time I'll use my shoe,
Yeah. All right.
jam it in there.
That'd be good.
Okay, so you can just have a seat right here.